I'm Dr. Gurmeet Kaur, consultant pediatrician and neonatologist working at Cloudnine, Ludhiana. Allergic rhinitis is that it's allergic in etiology, and rhinitis means that it causes itchiness, congestion, stuffiness of nose, sneezing, and it happens almost every day for 1 hour duration on exposure to allergens or on waking up. Now the allergens are which actually cause allergic reaction, and most of the time the allergens are which are inhaled, like pollens, dust mites, molds, and sometimes smoke. And sometimes some food allergens also can present with allergic rhinitis. So this happens very frequently, and if it happens every day persistently for 4 weeks, the symptoms of allergic rhinitis are labeled as persistent rhinitis. And as it causes a lot of itchiness in the nose, watering of eyes, and sometimes there can be other allergic manifestations like asthma in these children or skin atopy. So the blockage of nose can affect daily life, it can affect concentration, it can affect sleep. So this has effect on physical health but also on social well-being of the child. So it's very important that we recognize the allergens. Most common allergens are inhalant, that like pollen, smoke, dust mites, perfume sometimes, or change of environment, and it is seasonal. So as it is seasonal, so in those seasons, the prevention of exposure to pollen has to be avoided by staying indoors if it is really persistent and uncontrollable. And the allergens avoidance is the most important thing. Then other things what can be done is that nasal decongestants, oral anti-histaminic agents can be given, but local corticosteroids, nasal drops, nasal sprays are also very important. It's important that once the parents note that the child is having allergic rhinitis, because there may be a family history also. So to prevent these complications, like sometimes it can lead to sinusitis, because this can go into the surrounding nasal structures like sinuses, otitis media, ear infection, and it also can precipitate asthma. We know that almost 40% of the children have allergic rhinitis sometime in their lifetime. So it's important to control these symptoms by visiting a pediatrician or healthcare professional, so that besides guidance about allergen avoidance, the local corticosteroid therapy along with antihistaminics and sometimes anti-leukotriene inhibitors are given. And very uncontrollable allergic rhinitis, one can resort to immunotherapy, where the allergen tests are done and accordingly immunotherapy is planned by an allergen specialist.